Hello, Dr. Dilip Gude here, physician, Yashoda Hospital, Somajigoda, Hyderabad. We will discuss about why or is it really possible for a diabetic patient to bring down or actually stop use of insulin. Now, with the latest advent of new classes of anti-diabetic medicines, you can actually stop insulin use. Of course, this is not possible for every insulin using diabetic patient, but a good 50% of them, as in half of patients who are on insulin for their sugar control, for their fasting post-lunch sugar control, they can actually stop insulin. Yes, this is possible because of the newer anti-diabetic classes of medicines like GLP-1 receptor agonists, then you have SGLT2 inhibitors and various other newer medicines that are available like imiglamin, for example. So the emphasis is not just fasting and post-lunch control alone. You want medicines that actually protect heart and kidney, because a diabetic patient is at high risk of heart disease, heart attacks, heart failure, and then kidney disease as well. So these newer anti-diabetic agents, they not only bring down the need for insulin or the amount of insulin required to control sugars per day, but they can also protect heart and kidney over a period of time. So these are newer classes, and we recommend that more and more diabetic patients shift their anti-diabetic medicines from their older sulfonylurea group of medicines and insulin. In fact, there are patients who receive insulin 3 or 4 times a day, as in one shot of long acting, and then before breakfast, before lunch, and before dinner. So this adds up to probably 80 to 90 or even 100 units of insulin per day. With these new classes, you can bring it down to 30 units or less, or in fact over a period of time, over 6 months or so, you can actually make their insulin requirement per day 0, as in they can be put off of insulin. So how is that possible? When you try to bring down the body mass index, bring down the total body fat content of a diabetic patient, you are improving their insulin sensitivity. So the amount of insulin secreted by pancreas will be enough, and these newer classes of medicines will take it up from there and thereby minimize the need for insulin. And apart from lowering fasting and post-lunch control, these classes are going to protect their heart, kidney, even paralysis attacks, protect their legs also. Peripheral vascular disease is also very common in a diabetic patient. That also improves with these newer classes of medicines. So come discuss with us on ways to bring down your insulin use. Can you actually stop insulin? And we will be happy to discuss with you and help you, from get freedom from daily doses of poking with insulin pens and devices. Thank you.